Cats that are most at risk of getting sick from dangerous feline diseases are those that live outdoors, spend a lot of time outdoors, or live in homes with other cats. However, indoor-only cats and cats that are alone in a home can become ill too. Happily, most dangerous cat diseases and illnesses are preventable for indoor-only cats. But if they get one of the illnesses described in this video, it can be hard to treat. Feline rabies. Rabies viruses attack the feline nervous system, including the brain and spinal cord. Cats usually get it from the bite of another infected cat. Symptoms include uncharacteristic aggression, agitation, and excitement. Cats with feline rabies become less affectionate and keep away from humans and other cats in the household. They lose muscle control, especially near the mouth, and tend to drool a lot. They can have trouble swallowing. Feline rabies is fatal if not treated before symptoms appear. Once symptoms do appear, the cat usually dies within a week. Happily, vaccines are available, so rabies is now preventable and relatively rare in house cats. Feline distemper. There's a long name for feline distemper that most people never even try to pronounce. Feline distemper comes from a virus that's highly contagious and dangerous. It's usually transmitted through direct contact with blood, feces, or urine. It can also be spread by fleas from an infected cat. Noticeable symptoms include loss of appetite, depression, dehydration, vomiting, diarrhea, a rough coat, and a high temperature. Feline distemper can be debilitating and even fatal. Most vulnerable are kittens between the ages of 2 and 6 months, followed by pregnant and immune-compromised cats. Feline kidney disease and renal failure. Recent studies indicate that 1 cat out of 3 will suffer from kidney disease. The cat's kidneys can eventually stop working altogether, a condition known as feline renal failure. This stage, once reached, is permanent, and the cat is not likely to survive for long. There are 2 kinds of feline kidney failure. Chronic kidney failure develops over a long period of time for a variety of medical reasons. Acute kidney failure is usually caused by an injury or toxins in the cat's system. Acute kidney failure can happen in a matter of days. Most kidney disease symptoms don't become noticeable until kidney disease has already done considerable damage. When signs do start to appear, they include subtle weight loss, increased urination, and drinking a lot more water than usual. Feline leukemia virus. This is the #1 infectious disease that can be fatal to cats. FELV attacks and destroys the cat's immune system, making him or her vulnerable to a variety of health threats, especially anemia, cancer, and a range of other infectious diseases. Kittens and outdoor cats are particularly at risk. The most prominent symptoms include weight loss, loss of appetite, poor coat condition, lethargy, and pale gums. Feline immunodeficiency virus, or FIV. FIV is related to the HIV virus that causes AIDS in people. Some cats that have been infected show no symptoms, but others may start to experience lethargy, low appetite, weight loss, breathing difficulties, poor coat, skin problems, and inflamed gums. Feline immunodeficiency virus is usually transmitted through bite wounds from an infected cat, not from casual contact or by sharing water bowls. To learn more about other health threats that affect cats, click on the links in the description section for this video.